dangerous drug combinations you need to avoid. Number 1, combining NSAIDs like piroxicam, naproxen, and antihypertensives will lead to hypertension. Because the NSAIDs, though it doesn't happen in other drugs like aspirin, but NSAIDs inhibit prostaglandin synthesis, which will increase the muscle tone on your arteries, leading to those related effects on natriuresis and fluid retention. It counters the effect of the diuretics, which is supposed to cause hypotension or reduce your blood pressure. Your blood pressure, instead of reducing, it will now continue to rise. Drugs like rofecoxib, celecoxib have an intermediate effect on inhibition of the activity of antihypertensives. Number 2, combining levothyroxine and a PPI like omeprazole will lead to hypothyroidism. Now, levothyroxine is supposed to increase your hormonal level, that's your thyroid hormones. But because of the combination with omeprazole, which is a PPI that inhibits acid production, then levothyroxine will be hindered. The absorption of levothyroxine will be hindered because the PPI has calcium and magnesium, which will bind the levothyroxine and prevent its absorption. Besides, absorption of levothyroxine is better in an acidic environment. Number 3, combining grapefruit and drugs like simvastatin, lovastatin, or amlodipine will lead to a serious problem because grapefruit inhibits the CYP3A4 enzyme that is supposed to metabolize these other antihypertensives. So if it inhibits it, then all these antihypertensives, their concentration will rise in the plasma, so leading to a serious problem. Sometimes it leads to arrhythmias, sometimes it leads to hypotension. Now, number 4, combining warfarin and acetaminophen. We advise people to take acetaminophen when they are on warfarin because NSAIDs will cause PI bleeding. But this is a kept secret. Acetaminophen leads to a jump in your INR. Combining the two is a problem. Now, combining septrin and ACE inhibitor like lisinopril and quinapril is a no-no. Because septrin, the trimethoprim part of it, acts like a potassium-sparing diuretic. And ACE inhibitors also increases potassium levels. So because of that, you have hyperkalemia that can be lethal. In fact, sudden death has been reported in people that combine these two drugs. Number 6, combining nifedipine and clarithromycin is also a no-no. Clarithromycin inhibits the same metabolic enzyme we call CYP3A4. So if you combine it with nifedipine, what will happen? Dangerous levels of nifedipine in the plasma, and this will lead to hypotension. Drugs like azithromycin does not inhibit CYP3A4. So it is better to combine drugs. If you must give an antibiotic, please give azithromycin and nifedipine. It's a better combination. Number 7, combining gemfibrozil and simvastatin is a no-no. Gemfibrozil is a drug we use for dyslipidemia to lower your triglyceride level and your LDL level and increase your HDL level. Now, if you combine it with simvastatin, there's a problem because gemfibrozil with amiodarone and some other macrolides inhibit CYP3A4. Now, because they do this, if you combine the two, the metabolism of simvastatin will be hindered, leading to things like arrhythmias. Number 9, combining St. John's wort, which is a herbal remedy for depression. If you combine it with drugs that like cyclosporine that we use to prevent graft rejection after a renal transplant, if you combine the two, the St. John's wort, which contains hyperforin, will now induce cytochrome P450 enzyme, which will metabolize any other drug we combine it with, including cyclosporine. This will now lead to ineffectiveness of those drugs. So you have graft rejection. Now, these drugs, you need to know them, and even if they are prescribed for you and you see them, please do not combine them because it can cause serious and lethal problems to your system. I remain Dr. Nwechi Frederick. Investment in your health is your wisest decision.
PEP. Post-exposure prophylaxis.
These are HIV short-course medications.
Used to prevent HIV virus from taking hold in your body after a possible exposure to HIV. TEP medications are used by people who are HIV negative and they think maybe they have been exposed to HIV in the last 72 hours. Have you ever had unprotected sex with someone by mistake? Or because you were drunk at the club, or a one-night stand, or maybe you have been raped by someone you don't know? Or you have been defiled by unknown people at the party? Or you have had unprotected sex with a prostitute and you don't know their HIV status and you are scared that maybe you have been exposed to get the HIV virus? Well, these are right medications for you. You only take one tablet every day for 28 days only, then you won't get the virus. And you be negative as usual and you be happy forever. These medications, they work by preventing the virus from replicating after recent exposure. They work best when they are taken correctly. The sooner you start PEP after a possible HIV exposure, the better. TEP medications interferes with the pathways that HIV uses to cause a permanent infection in the body. After taking these medications, you have to do a follow-up test after 3 months until you are sure that there is no infection. Side effects of these drugs include nausea and fatigue. Advice: don't engage in sexual activities intentionally so that you can use these medications. Abstinence ni laka. Talk to your pharmacist for further guidance. Share this video so that your family and friends can benefit too.
Follow at Chalks Pharmacy for more.
Drug of choices for skin disorders. For severe erythrodermic psoriasis, cyclosporine. For erythrodermic psoriasis, methotrexate. For pustular psoriasis, retinoid. For dermatitis herpetiformis, dapsone. For atopic dermatitis, topical corticosteroids. For impetigo, mupirocin. For solar lentigines, tretinoin. For chancroid, ceftriaxone. For pemphigus vulgaris, prednisolone. For vitiligo, corticosteroids.
Medical Terminologist Nurse Quiz Part 2. Excessive growth of body hair. Hirsutism. Yellowish discoloration of skin. Jaundice. Pupillary dilatation. Mydriasis. Night blindness. Nyctalopia. Jerky movement of the eye. Nystagmus. Urine output less than 400 milliliters per day. Oliguria. Total loss of voluntary motor function. Paralysis. Ringing in the ears. Tinnitus. Purposeless movement of muscles. Tremors. Loss of peripheral vision. Tunnel vision. Uncontrollable passage of urine. Urinary incontinence. Yellowish color of vision. Centopsia. Dryness of mucous membranes. Xerosis. Dryness of the mouth. Xerostomia.